So the sore on your face that hasn't healed may in fact be skin cancer. Now I'm going to give you some information on the different types of skin cancer, possible treatments and removal, ways you can prevent it in the future, risks, and how to perform self-checks, and the skin cancer irregularities that should be watched for. There are 3 types of skin cancer. There's basal cell carcinoma. This type usually occurs on the skin that gets the most sun exposure. It can look like small shiny bumps. Then there's squamous cell carcinoma. It's usually found on the head, neck, and extremities. It can spread to the surrounding bones and tissue. Usually it begins as a dome-shaped bump or a red scaly patch of skin. It's usually rough and crusty and can bleed easily when scraped. Then there's melanoma. This is the most serious form of skin cancer. Even in its seriousness, though, it can be treated like the others if caught early on. Melanoma may look like a normal mole. It can have uneven edges, different colors, and just completely abnormal looking. Now, for the removal, surgical removal for basal cell and squamous cell skin cancer usually does the trick. But malignant melanoma, however, may require several treatment methods, depending on the size of the tumor, including surgery, radiation therapy, immunotherapy, and chemotherapy may be used for treatment. In the future, to prevent skin cancer, there are a few things that can be done. Always wear sunscreen with an SPF of at least 30 whenever you go outside. Don't forget to reapply. Avoid going outside when the sun is the hottest in the middle of the day. And always wear a hat or clothing that covers your skin, and never use tanning beds. Everyone that has excessive exposure to UV rays are at a risk for skin cancer. But people that have a fair light skin or light eyes or skin that freckles easily are at a higher risk of developing skin cancer. And lastly, to perform your self-exams, take note of all the freckles, moles, and blemishes that you may have on your body. You will need to look at them in a well-lit room and look for changes in shape, texture, and color. Use a mirror. It is recommended to get another person to look for you in places that you may not be able to see very well. If any changes are noted, please see your dermatologist. Thank you. I hope I have helped.